Hello, my name is Ana and I'm a fourth-year medical student from Belo Horizonte, Brazil. I would like to tell you more about the healthcare system in my country through the eyes of students, doctors, and patients. When I walk to my university, it's still fresh outside. In a couple of hours, the temperature will rise up to 35 degrees. In this heat, patients are waiting for their turn at the hospital. The waiting lines are long, but people get better healthcare than they did 30 years ago. Before 1990, the quality of healthcare in Brazil was low. The country had even less money than today, and isolated communities had no or little access to healthcare. Half of Brazil's population had no health coverage. Then, the Unified Health System, SUS, was implemented for all people in Brazil. It is a universal public health system financed by tax incomes. The poor can now get heart surgery, MRIs, and laboratory diagnostics all for free. 95% of all transplants are financed by the SUS. The development of products, medications, and vaccines is being sponsored by the SUS. Between 2003 and 2010, this sponsorship led to the development of 3 new vaccines and 2 new medications. The SUS also supports a robust vaccination program, prevention campaigns, basic dental care, and 90% subsidization of many essential medicines. You have to keep in mind that the setup of a vaccination program in Brazil is not the same as in the Netherlands. Brazil is the home for more than 200 million people distributed over a surface that is 205 times bigger than that of the Netherlands. So now, more than 20 years later, the health system has improved a lot. 75% of Brazilians are exclusively dependent on this free healthcare system coverage. The backbone of this system are the free primary healthcare centers. These centers are similar to the practice of the Dutch family doctor. Additional to a family doctor, there are dentists, physical therapists, pediatricians, and gynecologists. However, a lot of the consultations are done by students under supervision of a professor. My colleagues consult and examine the patients as if they are real doctors. At the end of their studies, they gain confidence and become experienced in doing consultations. This unified health system, SUS, was, on paper, a big step into improving the healthcare system. But in real life, the system still faces difficulties. Brazil has some financial issues. That is why the healthcare system is underfunded. Since the creation of the SUS, the government is spending less on health. Healthcare workers frequently go on a strike. They think that underfunding is the result of the lack of commitment of the federal government. The lack of money leads to problems in the basic healthcare infrastructure. For instance, the soap dispensers are always empty at the primary healthcare centers and in the hospitals. Besides the underfunding, the health system is not as sufficient as it could be. There is no central database where you can find all the information about the patient. Patients bring their own medical files and lab results. Some files stay at the hospital or primary healthcare center. To be up to date, the doctors then have to copy information from one file into another. They do this during the consultation by hand, which takes a lot of time. There are computers in most consultation rooms, but they are just not being used. So these computers are a waste of money. Many patients do not trust the primary healthcare services. They only come into the health system at the last minute, sometimes via hospital emergency departments. As a result, services are overcrowded with long waits and queues. People who are not content with the public health care have the possibility to go to a private practice. The private healthcare is better organized and easier to access, if you can afford it. The difference in accessibility of healthcare results in inequalities that are visible throughout Brazil. The vicious cycle of inequality starts with the education system. The public schools are of lower quality than private schools. After graduating a public school, you have a smaller chance to get into the university. You will be less likely to get a better paid job than the wealthier students of the same age. So you will not be able to develop and live in a better socioeconomic environment. To support the low-income families, the Brazilian government provides free nutritional food at some of the public schools. But the gap between rich and poor is not that easy to overcome. As a doctor, it is frustrating to see the system malfunctioning. We ourselves should contribute more to the improvement of the healthcare system in Brazil. Right now, we are trying to change the mindset of the population. We are trying to give priority to a preventive approach instead of thinking curative. By preventing disease in primary healthcare centers, the waiting lines at hospitals will become shorter, and this way, the high-risk patients will get earlier treatment and the distribution of medical facilities will improve. We would like to do more than we can, but we don't have all the facilities, financing, and structure. If we just put more money in the system without monitoring expenditure, this won't necessarily improve services. I think Brazil has made tremendous progress, but there is still a lot to do. We need a combination of good management and money.